We're back with my brother, Dr. Kevin Hunt, and Father Sam Okori, who are telling us about their organization called Manu Giving. It's manugiving.org.
Yeah, it's medical aid to northern Uganda, and it's called, the website is manugiving.org. What
do they need most in medical care? Because I know I've seen all the pictures, and Kevin lived through the whole story through you vicariously, and I hope to go with you guys soon. What's so important there that they need right away that we can help with?
Well, you know, Father Sam's in his 4th year of medical school now, so he got into medical school, now he's finishing up, he's going to go back, and that's a big thing is now a lot of doctors, from Uganda, when they finish their medical school, they come to the United States or they go to Europe, they don't stay in Uganda. Father Sam has made the commitment to go back to Lira, northern Uganda, and to take care of his people, so
I know, yeah. I know, Kevin, when you were there, you told me that even early in the morning until the wee small hours of the night, there'd be a line that you couldn't even see the end of. People just waiting to see you. The only doctor
we saw hundreds of patients when we were there, and you know, the thing is that we've spent some time in each of the health clinics in the little villages, and we also spent time in Bear Hospital, which is the main field hospital there in Lira. And what I noticed most is that the X-ray machine that they had was from 1950, and these doctors, we went on rounds with the doctors, and I was talking to them, and they said, you know, we can't really make a diagnosis of a patient that's sick because the X-ray machine doesn't work, and it's poorly. It's from 1950. Yeah, and in the building that's housed in, it's got cracks in the wall. And I said, well, these people have to come in here, and there's, you know, malaria, and the mosquitoes are flying around, and they have an X-ray machine that doesn't work. And I know from myself, from experiencing just, you know, working in Northwestern in Chicago, that we have the state-of-art equipment. We just wheel a patient in there, and we get the diagnosis within seconds. And that's the way you work efficiently and effectively to take care of patients. Father Sam and his colleagues do not have that leisure. They have an X-ray equipment that's from 1950. What our projects are going to do, and what we hope to do with our first project, is to build a new X-ray facility, a wing on Bear Hospital with, you know, state-of-the-art, at least X-rays, like when diagnosed pneumonia, ultrasound for pregnant women to make a diagnosis so that they can deliver properly. And so those simple things, just, you know, picking the low-hanging fruit and trying to get those projects going and just showing people that something's being done. That's what we're all about. We're not about just giving money to somebody and saying, do what you want with it. We're going to take these projects. Father Sam will be there. We'll pick them out. We'll do them. We'll show people that they're being done, and they'll come to fruition. And then these people will be, you know, just be something that'll be done for these people. And
you're even talking about getting solar panels put in, correct?
Well, yeah, Father Sam, we did get solar panels put in so that the doctors were going around. You know, when we were there, Father Sam and I, we had a flashlight. We're going around looking at the rooms, and we see, you know, a pregnant female lady with malaria, with a high fever, ready to deliver. She's laying on the cement floor, shivering with a little blanket on, like, you know, this is ridiculous. And there's no light, so we got solar panels for the hospital, and now they're able to at least do rounds with lights now in the middle of the night so they can see the patients without having to walk around with a flashlight. Those are just one of the things that, you know, we've accomplished through some donors, but I think that we have a long way to go. But taking one project at a time, I think it's very important. Father Sam, I don't know.
Father Sam, what do you say to people that might be watching if they could just donate a little money, how much it means to you, what you've lived through, and how you want to give back?
People who are our audience, people who are listening out there and watching, whatever you can do. Ideas, you can volunteer, you can donate, you can volunteer and come to Uganda and see it for yourself. I'll have accommodation for you, don't worry. Everything is there. So just volunteer and come, then we arrange. Probably by next year, January, I'll be back in Uganda, and whatever you can do. Also pray for us. You know, pray for us so that we bring healing to people. That's why I became a priest and now a doctor, so that I can bring healing to a human person. That's the most important thing, to the soul and to the body. So whatever you can do, you're most welcome.
Well, doesn't the show come full circle when you see what education has done for your life, right?
Yeah.
Brought you so you could give back fully to your community.
Not so many people will have, are so blessed like me to come all this far, and also, so what I can do is to give my life back to them through my service as a priest and through my service as a doctor. It's not about money. It's to bring healing to people, because there's so many doctors, homegrown from Uganda. They study and they come abroad. They come here to the U.S. to make more money. I'm going back to Uganda. There's no money there, but to serve the people who really need my help.
The other thing is Father Sam, there's a donor in Chicago that Father Sam said, well, how am I going to go to medical school? I can't afford it. Nobody can afford it in Uganda. All of a sudden, there's this person that shows up in Chicago and says, not only am I going to pay for his pre-med, I'm going to pay for his medical school.
Yeah.
I mean,
there's a lot of goodness. There's a lot of goodness in the world.
There's a lot of goodness in people, but only if they hear about it. If they don't hear about it, they will not help, because they don't know.
Right.
So I like to thank the parish where I live, St. Ita, and the priests there, Father Dave, and the parishioners, and also Bob, who has been helping me and helping the people where I come from. So I'm very grateful to everyone.
Well, we're grateful for you, Father Sam, and for you, my brother, Dr. Kevin Hunt. Thank you both. You guys, to find out more information about how you can help Kevin and Father Sam reach their goal of fundraising for the people of northern Uganda, you can go to our website, bonniehunt.com, and manugiving.org. We'll be right back.